Welcome to our deep dive into the world of autoimmunity. Today we'll explore what autoimmunity really means, why it matters, and how it affects millions of people worldwide. Whether you've heard the term before or this is your first time encountering it, understanding autoimmunity is crucial for grasping how our bodies defend, and sometimes mistakenly attack themselves. Let's start by setting the stage for our journey into the immune system's fascinating and sometimes puzzling behavior. By the end of this video, you'll have a clearer picture of what autoimmunity is and why it's such an important topic in health today. Autoimmunity is a term that describes a unique and sometimes problematic feature of our immune system. Normally, our immune system acts as a powerful defense network, protecting us from harmful invaders like bacteria and viruses. But in autoimmunity, this system gets confused. Instead of only targeting threats, it mistakenly attacks the body's own healthy cells and tissues. This can lead to a wide range of symptoms and health issues, depending on which part of the body is affected. Understanding this process is the first step in recognizing why autoimmune disorders can be so challenging to diagnose and treat. Autoimmune disorders are a group of diseases that occur when the immune system, which is supposed to protect us, mistakenly attacks our own body. These disorders can affect almost any part of the body, from the skin and joints to vital organs like the heart or kidneys. There are more than 80 known autoimmune diseases, each with its own set of symptoms and challenges. Some common examples include type 1 diabetes, rheumatoid arthritis, and lupus. The underlying cause is the same. The immune system can no longer distinguish between what is foreign and what belongs to the body. Truly understand autoimmunity, it helps to know how the immune system works. Think of it as your body's security team, always on the lookout for anything that doesn't belong. It uses a complex network of cells and signals to identify and destroy invaders, but sometimes this system makes mistakes. In autoimmune disorders, the immune system's ability to tell friend from foe breaks down, leading to attacks on healthy tissue. This confusion is at the heart of every autoimmune disease, making them both fascinating and difficult to manage. Scientists are still working to fully understand why autoimmunity develops. It's believed to be a combination of genetic, environmental, and possibly even lifestyle factors. Some people may inherit genes that make them more likely to develop autoimmune diseases, while others might trigger these conditions through infections, stress, or exposure to certain chemicals. The exact cause often remains a mystery, but research continues to uncover new clues about what sets the immune system on this misguided path. Genetics play a significant role in the development of autoimmune disorders. If you have a family member with an autoimmune disease, your risk may be higher. Scientists have identified certain genes that are linked to a higher likelihood of developing these conditions. However, having these genes doesn't guarantee you'll get an autoimmune disease. It just means your chances are increased. This genetic connection helps explain why some families see multiple members affected by similar condition. While genetics set the stage, environmental factors often act as triggers for autoimmune diseases. These can include infections, exposure to certain chemicals, or even dietary factors. For example, some viral or bacterial infections are thought to confuse the immune system, prompting it to attack healthy tissues. Environmental triggers are an active area of research, as understanding them could help prevent or better manage autoimmune conditions in the future. There are over 80 different autoimmune diseases, each affecting the body in unique ways. Some of the most common include type 1 diabetes, where the immune system attacks insulin-producing cells in the pancreas, rheumatoid arthritis, which targets the joints, and multiple sclerosis, where nerve coverings are damaged. Each disease presents its own set of symptoms and challenges, but all share the underlying problem of immune system confusion. Symptoms of autoimmune disorders can vary widely, depending on which part of the body is affected. Common symptoms include fatigue, joint pain, skin problems, and recurring fevers. Some people may experience symptoms that come and go, while others have chronic issues. Because these symptoms are often similar to those of other illnesses, diagnosing autoimmune diseases can be challenging. Early recognition and medical attention are key to managing these conditions effectively. Diagnosing an autoimmune disease often requires a combination of medical history, physical exams, and laboratory tests. Doctors may look for specific antibodies in the blood, signs of inflammation, or patterns of symptoms that match known autoimmune conditions. Because symptoms can overlap with other diseases, it sometimes takes time and multiple tests to reach a diagnosis. Early and accurate diagnosis is important for starting effective treatment and improving quality of life. Treating autoimmune disorders usually involves managing symptoms and controlling the immune system's activity. Medications such as anti-inflammatory drugs, immunosuppressants, and biologics are commonly used. Lifestyle changes like a healthy diet and stress management can also make a difference. The goal is to reduce immune attacks on the body while minimizing side effects from treatment. Each person's treatment plan is unique, tailored to their specific condition and need. Living with an autoimmune disorder can be challenging, but many people lead full and active lives with the right support and management. It often involves regular medical care, making healthy lifestyle choices, and staying informed about new treatments. Support from family, friends, and patient communities can make a big difference in coping with the ups and downs of these conditions. Staying positive and proactive is key to maintaining quality of life. Autoimmune disorders can affect many aspects of daily life, from work and school to relationships and hobbies. Some people may need to adjust their routines or take breaks to manage fatigue and other symptoms. It's important to communicate with employers, teachers, and loved ones about your needs. With understanding and flexibility, many people find ways to balance their health with their personal and professional goals. Coping with an autoimmune disease isn't just about physical health, it also involves emotional well-being. Feelings of frustration, anxiety, or sadness are common, especially when symptoms flare up or interfere with daily life. Seeking support from mental health professionals, joining support groups, or talking with friends and family can help. Taking care of your emotional health is just as important as managing physical symptoms. Diet and nutrition can play a role in managing autoimmune diseases. While there's no one-size-fits-all diet, eating a balanced and nutritious diet can help support overall health and reduce inflammation. Some people find that certain foods trigger symptoms, so keeping a food diary and working with a healthcare provider or nutritionist can be helpful. Staying hydrated and maintaining a healthy weight are also important for managing symptoms. Regular exercise can benefit people with autoimmune disorders by improving strength, flexibility, and mood. Activities like walking, swimming, or yoga are often recommended, but it's important to listen to your body and avoid overexertion. Working with a physical therapist or fitness professional who understands autoimmune conditions can help you develop a safe and effective exercise plan. Staying active supports both physical and emotional well-being. Stress can have a significant impact on autoimmune diseases, sometimes triggering flare-ups or worsening symptoms. Learning to manage stress through relaxation techniques, mindfulness, or hobbies can make a big difference. Practices like meditation, deep breathing, or spending time in nature are helpful for many people. Finding what works for you and making stress management a regular part of your routine is an important part of living well with autoimmunity. Getting enough quality sleep is essential for everyone, but especially for those with autoimmune disorders. Poor sleep can worsen symptoms and make it harder to cope with daily challenges. Establishing a regular sleep routine, creating a comfortable sleep environment, and avoiding screens before bed can all help improve sleep quality. If sleep problems persist, talking to a healthcare provider is important. Keeping track of symptoms is an important part of managing an autoimmune disease. Many people find it helpful to use a journal or app to record symptoms, medications, and any changes in health. This information can help you and your healthcare team identify patterns, triggers, and the effectiveness of treatments. Regular monitoring empowers you to take an active role in your health. Building a strong partnership with your healthcare providers is key to managing autoimmunity. Regular checkups, open communication, and asking questions about your treatment plan help ensure you get the best care possible. Don't hesitate to seek second opinions or consult specialists if needed. Remember, you are your own best advocate when it comes to your health. Having a strong support system can make a big difference for people with autoimmune diseases. Family, friends, and support groups provide emotional encouragement, practical help, and a sense of community. Connecting with others who understand what you're going through can be especially comforting. Don't be afraid to reach out and build your support network. Autoimmune diseases can affect people of all ages, including children. Pediatric autoimmune disorders may present differently than in adults and can impact growth, development, and school life. Early diagnosis and treatment are especially important for children, as is support from family, teachers, and healthcare providers. With the right care, children with autoimmune diseases can thrive. Women are more likely than men to develop autoimmune diseases. Hormonal differences, genetics, and environmental factors may all play a role. Some autoimmune conditions like lupus and thyroid disorders are especially common in women. Understanding these gender differences can help with early detection and tailored treatment approaches. Although less common, men can also develop autoimmune diseases. Some conditions, such as type 1 diabetes and ankylosing spondylitis, are more frequently seen in men. It's important for men to be aware of symptoms and seek medical attention if they notice changes in their health. Early intervention can help manage symptoms and prevent complications. As people age, the risk of developing autoimmune diseases can change. Some conditions become more common with age, while others may improve or stabilize. Aging also affects the immune system's function, which can influence how autoimmune diseases develop and progress. Regular health checkups and staying active are important for older adults managing autoimmunity. Pregnancy can have unique effects on autoimmune diseases. Some women experience improvement in symptoms during pregnancy, while others may see flare-ups. Managing autoimmunity during pregnancy requires close coordination with healthcare providers to ensure the health of both mother and baby. With proper care, many women with autoimmune diseases have healthy pregnancies and babies. Research into autoimmunity is ongoing, with new discoveries being made every year. Scientists are working to better understand the causes, develop more effective treatments, and even find ways to prevent autoimmune diseases. Advances in genetics, immunology, and personalized medicine are offering hope for improved outcomes in the future. Personalized medicine is an exciting area in the treatment of autoimmune diseases. By understanding each person's unique genetic makeup and immune system, doctors can tailor treatments to be more effective and have fewer side effects. This approach is still developing, but it holds great promise for the future of autoimmune care. Immunotherapy is a treatment approach that aims to modify the immune system's activity. In autoimmune diseases, this can mean suppressing overactive immune responses or retraining the immune system to stop attacking healthy tissues. New immunotherapies are being developed and tested, offering hope for more targeted and effective treatments. Vaccines play an important role in protecting people with autoimmune diseases from infections. However, some vaccines may not be recommended for certain individuals, especially those taking immunosuppressive medications. It's important to discuss vaccination plans with your healthcare provider to ensure you stay protected while managing your autoimmune condition. While not all autoimmune diseases can be prevented, some steps may help reduce risk. Maintaining a healthy lifestyle, avoiding known environmental triggers, and managing stress are all important. Early detection and prompt treatment of infections may also play a role. Ongoing research continues to explore new ways to prevent these complex conditions. Some infections are thought to trigger autoimmune diseases in people who are genetically susceptible. For example, certain viruses or bacteria may confuse the immune system, leading it to attack healthy tissues. Understanding the link between infections and autoimmunity is an important area of research and may help guide prevention and treatment strategies. There is a complex relationship between autoimmunity and cancer. Some autoimmune diseases may increase the risk of certain cancers, while others may offer some protection. Treatments for autoimmune diseases can also affect cancer risk. Understanding these connections helps doctors make informed decisions about treatment and monitoring. Autoimmune diseases and allergies both involve the immune system, but they are different conditions. Allergies occur when the immune system overreacts to harmless substances, while autoimmunity involves attacks on the body's own tissues. Some people may have both allergies and autoimmune diseases, and research is exploring possible connections between the two. Some autoimmune diseases can affect the brain and nervous system, leading to symptoms like memory problems, mood changes, or difficulty with movement. Multiple sclerosis is a well-known example, but other conditions can also impact brain health. Early recognition and treatment are important for preserving cognitive function and quality of life. Autoimmune diseases can also affect the heart and blood vessels, leading to increased risk of heart disease, inflammation, or other cardiovascular problems. Regular monitoring and heart-healthy lifestyle choices are important for people with autoimmune conditions. Working closely with healthcare providers helps manage risks and maintain heart health. Many autoimmune diseases can cause skin symptoms such as rashes, blisters, or changes in skin color. Conditions like psoriasis and lupus are known for their skin involvement. Managing skin symptoms often requires a combination of medications, skincare routines, and avoiding triggers. Dermatologists play an important role in the care of these patients. Gut is another area commonly affected by autoimmune diseases. Conditions like celiac disease and Crohn's disease involve immune attacks on the digestive system. Symptoms can include abdominal pain, diarrhea, and weight loss. Managing these conditions often involves dietary changes, medications, and regular monitoring by healthcare providers. Joint pain and inflammation are common symptoms of many autoimmune diseases such as rheumatoid arthritis and lupus. These conditions can lead to stiffness, swelling, and reduced mobility. Early treatment and physical therapy can help manage symptoms and prevent joint damage, allowing people to stay active and maintain independence. Some autoimmune diseases can affect the eyes, causing symptoms like dryness, redness, pain, or vision changes. Conditions such as Sjögren's syndrome and uveitis are examples. Regular eye exams and prompt treatment of symptoms are important for preserving vision and eye health. Hormonal changes can influence the development and course of autoimmune diseases. Conditions like Hashimoto's thyroiditis and Graves' disease directly affect hormone-producing glands. Managing these diseases often requires hormone replacement or regulation, along with regular monitoring by healthcare professionals. The kidneys can also be affected by autoimmune diseases, leading to conditions like lupus nephritis. Symptoms may include swelling, high blood pressure, or changes in urine. Early detection and treatment are important for preserving kidney function and preventing complications. Some autoimmune diseases can cause lung problems such as inflammation, scarring, or difficulty breathing. Conditions like sarcoidosis and systemic sclerosis are examples. Regular lung function tests and working with specialists help manage these symptoms and maintain respiratory health. Autoimmune diseases can affect the blood, leading to conditions like autoimmune hemolytic anemia or thrombocytopenia. Symptoms may include fatigue, easy bruising, or frequent infections. Blood tests and specialized treatments are important for managing these conditions and preventing complications. Autoimmunity is a complex and fascinating area of medicine, affecting millions of people around the world. Understanding what autoimmunity is, how it develops, and how it can be managed empowers individuals to take charge of their health. Ongoing research and advances in treatment offer hope for better outcomes in the future. By staying informed and proactive, people with autoimmune diseases can lead fulfilling lives and look forward to new possibilities in care.